of a look behind the job posting. I am your host, Paul Moss, and I am one of the recruitment, marketing, and sourcing coordinators here at UNC Health. In these episodes, we're going to pull back the curtain and provide you with an in-depth look at some of UNC Health's departments and open positions. As always, we have a terrific show lined up for you today, as we'll be joined by Chatham Hospital's Chief Operating Officer and the Director of the Emergency Department, along with a recruiter for Chatham Hospital. If you have any questions or feedback during the show, please throw your comments into the chat and we'll get them answered for you. Our first guest is the Chief Operating Officer and Chief Nursing Officer for Chatham Hospital. Please welcome Eric Wolak. Can you please tell us a little bit about Chatham Hospital?
Chatham Hospital has had a footprint in Chatham County and Siler City specifically since the 1930s. It started out in a physician's home in downtown Siler City. And then in the 1940s, they built a traditional brick and mortar hospital also in downtown Siler City. Chatham Hospital operated out of that structure through the 40s, 50s, 60s, 70s, 80s, 90s, and early 2000s, offering a wide range of services to the community from maternity care, critical care, emergency department care to primary care and the like. In the early 2000s, UNC Healthcare System had an opportunity to purchase Chatham Hospital, and so they went through that process. So Chatham Hospital is owned by UNC Healthcare System. I want to clarify that while we're owned by the system, we are our own hospital. We have our own board, we have our own president and executive team, but we are owned by the system, and that offers us a lot of benefit in terms of implementing electronic medical records, supply chain management, HR support, recruitment support, and the like. We are a 25-bed critical access hospital, and that is a specific designation that requires some definition. First, in order to be a critical access hospital, you cannot have any more than 25 beds. You have to also be 35 miles or farther from another healthcare facility. So typically, critical access hospitals serve rural areas. And with that designation, our payment structure is a little bit different to help ensure that we can keep our doors open to continue serving a rural community. In addition to being a critical access hospital, we can care for skilled nursing patients here in our facility, and that's unique to critical access hospitals. Those 25 beds does not include our ED. And the ED, which Keith will speak to much more robustly, is an outpatient setting. So we have our emergency department, and we have two inpatient areas, one that is an acute care unit that is really split off into two different departments. I will say that while we are separate from the medical center, our physicians, by and large, are through the School of Medicine at University of North Carolina. And most of our physicians here at Chatham Hospital are family medicine physicians. So our ED is staffed by family medicine physicians, and our inpatient physicians are also through the Department of Family Medicine. We do have surgical services here as well. We have 2 operating rooms and 3 procedural rooms. Most of our surgeons also have affiliation with the Department of Surgery at UNC School of Medicine, but some of our surgeons are community surgeons that have privileges here. Most of our surgeries are outpatient, but we offer a wide range of surgical services, including general surgery, gynecological surgery, optometric surgery, ENT, and orthopedics.
Do you have any big projects or goals currently in the works that you would like to share?
I'll speak to 2 because I think they're relevant to what I referenced to earlier. One is involving our emergency department. As I mentioned, we have a 10-bed ED. Again, Keith will speak more to it, but it serves the whole community. On an average day, they see about 50 patients, and they will see anything and everything that comes through the doors, whether it's pediatrics or geriatrics. So one project we are working on is reducing our left without being seen. And those are patients or potential patients who come into our doors to seek emergency department care and may end up leaving because they feel like the wait is too long. We want to reduce that significantly to almost nothing so that we can continue serving the community. And the other has to do with our surgical services. We want to make sure that we are starting our scheduled cases on time. So we're looking at our first case on time starts to make sure that we have everything all of our ducks in a row. The patient has been consented and informed. The physician is here and scrubbed in. Anesthesia is here and scrubbed in. The team has all communicated to one another and the patient that they're doing the right surgery, and then start the surgery on time.
What are some of the challenges you're facing at Chatham?
Like a lot of healthcare facilities right now, we are really challenged with staffing, and that is true both from a nursing standpoint and also a non-nursing standpoint. Every area has openings that we are recruiting for. Every hospital in the area we are competing against. The other challenge, and it's related to that, is COVID-related absences. We should acknowledge that pandemic is not over. People are still getting COVID, sometimes multiple times. And while we aren't seeing a huge influx in hospitalizations, we have to acknowledge that when our staff get COVID, they are out of work for 5 to 10 days. And when you're already struggling with staffing challenges and you have someone out on a COVID-related absences, that can further impact and emphasize the staffing challenge that we have.
What are you doing to help recruit and retain employees?
I'll start with retain because in my opinion, that's the most important thing. I want to keep the great people that we have. We're really trying to be as transparent as possible. We hold town hall meetings every 2 months with senior leadership and staff. We have a Glad You Asked box in the hospital where anyone can write a question and senior leadership will respond to that question. We are doing stay interviews every 6 months where I, as a leader, and I ask my team also as leaders to sit down with their employees and me with my employees and really have a thoughtful conversation about what's keeping them here at Chatham Hospital. We start every meeting off with one good thing. So we go around and say what's good is happening to us. And we really promote an initiative called Random Act of Kindness, where one department or person will randomly do something nice for another department or person. So those are just some of the initiatives we've done to retain our staff. We've also worked a lot on our salaries here at Chatham Hospital. We've invested over $1 million in increasing staff salaries over the past year and a half. And that's pretty dramatic. And for our staff that are on the lower end of the pay scale, that's had a real impact on their day-to-day lives. In terms of recruitment, we really want to highlight the great care we give at Chatham. Chatham Hospital is a 5-star patient experience hospital. I want to note there's only 5 hospitals in the entire state of North Carolina that have a 5-star patient experience, and Chatham Hospital is one of those. In addition, for recruitment, we are offering commitment incentives for people who join our teams that are not part of the UNC healthcare system. We host students on a regular basis from surrounding colleges to make sure we're introducing them to Chatham Hospital and hopefully incentivize them to apply here when they graduate. The list goes on in terms of what we're doing to try to capture really great talent.
Are there any unique or interesting things that Chatham Hospital does that other hospitals may not do?
I say the most important and unique thing that we do is we do everything. So at a critical access hospital, you have to be very flexible and be able to work in various areas. Because our bench is fairly small because we're a small hospital. But our patients still need care. So I'll give you some brief examples. If you are a nurse in our acute care unit and that unit's census is lower than usual, and you or someone in your team is not needed that day, you may be asked to go to the emergency department to help in the ED. I also mentioned something I referenced earlier is our skilled nursing population. That's also very unique to critical access hospitals. That really helps people who need skilled nursing care stay near their homes.
Eric, we really appreciate the insight you've given us today. Thank you so much. Our next guest is the director of Chatham Hospital's Emergency Department. Please welcome Keith Stinson. For those who are not familiar with the ED, can you please give us a little background on the department?
Chatham Hospital's Emergency Department is a 10-bed unit. We see everything from birth to geriatrics. We also have our non-acute patients as well as our acute trauma patients that come through the emergency department. That's one of the unique experiences that you'll have at Chatham Hospital, whether it's in the inpatient unit or in the emergency department, is that we take care of patients with all types of chief complaints. Our units are not specialized in being just a cardiac unit or an orthopedic unit. You need to have a broad base of knowledge in order to provide care at Chatham Hospital.
So what makes the ED different from other departments?
So with our emergency department, when you first come in, you're going to have a customized orientation. We're going to ensure that we matched you with a preceptor who's got the same similar personality as you, as well as understands how you like to learn. After that, you're going to experience a diverse group of patients. You may have a 6-month-old in one room and a 96-year-old in another room. And you as an individual get to find out how to interact with those individuals differently. But what you're going to learn is that as a critical access hospital, while we are reduced in maybe our physical size, we are not reduced in our quality of care. We hold ourselves to the same level of expectations that larger institutions have, such as our door to EKG times for our STEMI patients and getting them to a cath lab, stroke care, or even sepsis care, and ensuring that we've got the sepsis bundle elements completed in a timely manner.
What does a typical day for a nurse look like in the ED?
In the emergency department, we staff with 3 nurses in the morning starting off. Your shift is going to, in the daytime, your shift is going to start off slower, and it's going to pick up gradually throughout the day. We have a dedicated triage nurse who is there going through and initially evaluating patients and placing them in rooms. And then you're going to be provided with a wide range of experiences, starting IVs, drawing blood work, typical medications, but we also do some additional procedures on patients in the emergency department. Our physicians may start an arterial line, so we're responsible for managing an arterial line and arterial pressures. May have a patient on a continuous drip. One of the unique things about an emergency department as a critical access facility is we are dependent upon our nursing staff to have some additional skills. So we do teach nurses how to do an IO insertion on patients who are critical, because our physicians may be tied up doing other things and can't get a central line initially.
Can you tell us about the clinical ladder opportunities within the ED?
With our relationship with UNC Healthcare System, we've instituted a clinical ladder. A new graduate starts out as a clinical nurse 1. After 1 year experience, they are promoted up to a clinical nurse 2. And if you have experience coming from an outside institution, you would start off as a clinical nurse 2. The clinical nurse 3 role ultimately is looking for someone who's looking to be more engaged in the facility as well as in the department. That could be included in teaching a unit-based education program, or PALS or ACLS. Also looking at getting your advanced certification, such as a certified emergency nurse, or on the med-surg side, an acute care nurse certification.
We might have some listeners who are interested in joining the ED. Can you provide them with some qualities that are not listed within the job description that you're looking for in an ideal candidate?
So when you think about the emergency department setting, ultimately there's a couple things. You have to be willing to adapt to changes that happen immediately. You may have one room that you have a plan and you're going with, and all of a sudden something changes and you've got to switch course and be able to quickly adapt. Initiative is another thing. We anticipate what's needed with our patients. And so whether you have an abdominal pain coming in, we're instituting standing orders and we're going ahead and carrying out some of those pre-approved protocols that we're allowed to do as nurses. So taking that initiative and starting that care, maybe before a physician sees someone. Teamwork is one of those other elements that is essential to an emergency department and a critical access hospital in general. With only 3 nurses, maybe 4 at times, the emergency department relies on one another. We overhead page our rapid responses in code blue so that other individuals from the hospital come to the emergency department to assist us. We understand that we have some limitations in that regard and therefore rely on other departments in order to achieve our patient care objectives. You're also going to need communication, whether that's communicating with your coworkers, communicating with the patient and their family, or with our physicians. We have very close relationships with our physicians, and they expect our nursing staff to question maybe something that they're not understanding why they're doing it. And so if you're getting ready to give a medication and you don't have clear understanding, our physicians expect that you come and you talk to them about what you're getting ready to do. If you're interested in the emergency department or joining Chatham Hospital in general, my recommendation would be reach out to us. Come and see the hospital. We'll let you walk in. We'll give you a quick tour of the location and the facilities. We'll let you talk with nursing staff. We are completely transparent in how we go about displaying our units.
Keith, thank you so much for being here today. Our final guest joins us from the talent acquisition team. Please welcome senior recruiter Marissa Jackson. Can you please tell me about the incentive opportunities that are available within Chatham Hospital?
Right now, currently at Chatham Hospital, we do have 2 incentives that we are offering. One is a commitment-based incentive up to $10,000 for a 2-year commitment. That is based on the eligible position, and also if it is received, the payments are spread out within 6-month increments of hire. The second one we do offer is relocation. Relocation is up to $5,000, and that also is based on mileage to the current facility.
I believe some of Chatham's positions are eligible for the new employee referral program. Can you please tell us a little about that?
UNC has just implemented the employee referral. Current employees will receive anywhere up to $3,000 for a referred qualified employee. That could be a nurse, that could be a surge tech, or a nursing assistant. They are paid out in 2 equal installments.
Marissa, you've been very helpful. Thank you very much. That concludes our 3rd episode. Please join us next month as we'll be joined by some very special guests. Until then, remember to see yourself at UNC Health.